10, 12 years ago that we started doing this research. We began to start looking at issues that could be related to the health of our athletes, our waxmen, our technical officials, and so on. And one of the issues that came to our concern was whether or not these waxes would pose a health risk to those who would be using it in the field. But in having discussions with professionals in this area, such as Mr. Tim Collins, who you'll be hearing about in this video as well, we found out that there were very strict industrial respiratory standards for working with these products.
I was working in the injection molding industry, specifically injection molding of Teflon components, and we had a real problem with people that were running the molding machines getting sick, like getting the flu. And through this process we attempted to create exhaust systems to suck the fumes up and away from the person. But what we also noticed is that the smokers were getting the symptoms of this flu-like condition far worse. And through that, we come to realize that they had Teflon resin on their fingers and they were re-burning that resin when they smoked a cigarette. So we instructed the facility to raise the exhaust stacks and increase the airflow in the exhaust. And at which time we sent contractors up onto the roof, and they said, gosh, in the southeast corner of your building you have all kinds of dead birds on the roof. So we raised the stacks, and it seemed like within a couple weeks we had mounds of dead birds on the edge of the parking lot. So now instead of dying and landing on the roof of the building, they were dying and landing on the edge of the parking lot. And one of the things that we noticed in humans were that these fumes created a shortness of breath and then extenuating flu-like symptoms for about 24 hours. This syndrome became known as Polymer Fume Fever. It was addressed through our environmental health and safety folks, and there was just nothing that could be done that anybody understood.
It was at that point that we decided that as a medical committee for the International Biathlon Union, we should try and make comments and changes that would protect the future health of our athletes.
I'm a high-level athlete as well. I know that, it takes the lungs some time to process particulate matter. So even if I'm scraping and brushing CH or non-fluorinated waxes, I'll usually use some sort of respirator to cut down on particulate matter into my lungs. I do know if I am waxing a lot, and I have done some in the past without a respirator, you breathe in, your lungs don't feel as good, you cough more. There's a period in the morning before races where from 5 a.m. to 10 a.m. they're burning florals constantly in just the whole wax room. And even the whole wax compound is surrounded in a fog of floral fumes. You kind of run in for a quick second to grab your race skis and run out. So usually I take a big breath before I go in, give them the thumbs up, grab my skis, and I'm out of there really quick. I think it's just that fear of, I don't know what this is going to do long term. So some coaches are taking more precautions than others. And some venues are putting, ventilation systems in wax rooms, or all they're just doing is shooting the air outside.
Oh, greater than 10 years ago, people would talk about it. I owned a respirator, but only used it for the really potent waxes like pure fluorocarbons and high fluorocarbons. We are really the largest independent performance cross-country ski store in the U.S. in terms of the number of skis we have and the amount of ski accessories we sell. And so we wax skis for customers all over the U.S. We ship skis and we wax a lot here. So it's a constant nag in my mind, what am I doing? Should I really be wearing a respirator every single day? Because they're a pain. Once you spend a day in a respirator, then you kind of know that world. I am concerned. I mean, we run a ski grinder, has a lot of emulsions, a lot of fumes. We wax, we do a lot of fluorocarbons during the race season.
and I want to make sure that everyone works here, leaves here as healthy as they came in. I think there is information that fluorocarbons can be harmful. Again, I'm not a scientist either. We just try to get wax on the skis and move ahead. But it is very important, if there is a risk, to figure out how to mitigate it.
On the World Cup circuit, which was the highest level of the sport, we found that many wax rooms had very poor ventilation, if anything at best. Usually the way to ventilate the room was just to open the door. The information that we were able to obtain through our research in the literature and through case reports on fluorocarbon waxes and fluorocarbon compounds in particular was really quite concerning to us. And we had two concerns on these. One was from a health point of view from our waxman technicians and officials. The other issue was an environmental health issue, because the wax ventilation systems that did exist, as well as the disposal of the products from these waxes, was pretty much directly into the environment. Ventilation systems would go right outside into the ambient air, so anybody who was walking by would be exposed to these substances. And really, who knows where the wax scrapings went? We really don't know, even to this day, how those are controlled. Well, then to summarize the toxic effects for humans, we know that inhaled ingestion can lead towards changes towards lung cancer. We know that oral ingestion and probably the inhaled ingestion can lead towards liver and renal cancer. And there's a lot of evidence that demonstrates that these compounds also suppress our immune system with as much as 90% suppression of immune function. Since that time, with our research, we have really firmly believed that this is a health issue for our participants in the sport. We've effected changes this way. We've had some ventilation changes done to rooms. People have tried their best to try and have a good ventilation. We've removed athletes from the wax environment. We've had people not eat in the wax environment. And all these things are great, but it's not enough. We know from the fluorocarbon industry that removing as much of the toxic compounds from the environment, the ambient environment with which you're working, is what we need to do. So a system like this that is going to be shown to you here, I think, is the best solution. We're able to completely filter the air so that the compounds are not recirculated. They're removed from the environment before the athlete can even get them into their lungs. And there's also a disposal mechanism to remove them afterwards in a controlled way through, to industrial standards.
Dr. Carberry and I set out to do something about this, to help people to deal with this problem and come up with a solution that ultimately someday could improve the sport. And we formed a business called Wax for Life and developed a product called the ROYKBORD, which stands for fume table. We seen some venues that tried to create dampened makeup air, but then we noticed that these wax technicians and other users would just tape those vents shut because it was cold. It just made the air in the room so cold that they might as well go outside and wax their skis. So we came up with a theory and a process of a downdraft system. It does two things. Immediately removes the poisonous fumes from the breathing path of the wax technician. It takes advantage of the heavy molecule of fluorine and brings it down rather than reintroducing it to the breathing path. And it gives us an opportunity to collect dust and debris and scrapings that come from the operation itself. So through the downdraft mechanism, we have an opportunity to capture environmentally hazardous scrapings that should not go in the garbage, should not get thrown outside. The whole system being a closed loop system and requiring no makeup air. And ultimately this device will enhance the air quality in a room from prior to a waxing event. It's likely that there will be regulatory rules coming forward to deal with those types of issues.
We have the tools to be able to deliver certification tests online and ensure that technicians are certified before they're using the product. And we've developed a system of putting access control into the facilities as well, so that only certified technicians have the system available to them. There's a real liability protection in this, and being able to control the access to their ROYKBORD devices and in being able to ensure that their workers are certified on them. The certification process helps to protect the wax technician, because in going through the certification process and taking the exams that are necessary to pass the certification, they learn how to administer the system and how to know when the system's not working. And that helps to protect the technicians so that they don't get into a situation where the machine's not working and they're exposed to the toxins. The access control helps to protect the venue itself by not allowing uncertified technicians that may not be familiar with the system to get access. We want to be able to look at airstream data from the ROYKBORD device for a couple reasons. One reason is that we want to be able to aggregate and accumulate data over the years so that in time it can be made available to the medical and the other technical professionals in the industry so that they can better evaluate the problem that we're facing with these toxins. Trends in airstream based on different waxes, as new waxes are introduced to the industry and starting to be used by the technicians, you establish a baseline and then you establish a trend of lung function over time as they continue to use the ROYKBORD device.
Our product offering really comes in three phases. One is the ROYKBORD fume table that has options of control, being simply on-off for the typical non-professional user who wouldn't have a ski waxing technician available as a team member, to the system that would have data acquisition and control and provide monitoring, historian, trending, and also predictive maintenance features that would allow the facility owner to maintain the integrity of the system. The second product offering is adapter kit for the home type user that has his own bench or his own clamping fixture that would like to enjoy the peace of mind that goes with knowing that he is waxing his skis in a safe way. And this is nothing more than a simple downdraft adaptation that can be placed right under an existing waxing table. And then the last of the product offering would be a centralized system that would be used at a permanent venue, be it a professional event that would encompass a construction project that would entail many wax cabins built into a building. We are making available to the architectural engineering firms a license of this patented technology to be incorporated into a major facility design and build.
And this is going to mean a substantial investment in our World Cup sites. I would love to see a World Cup site step forward and be a steward of this and be a model for the future. Certainly Sochi would be a great place for this because of the upcoming Olympics. The challenge is out there for somebody to adopt this and run with it. And I'd certainly, for one, as would our medical committee, be happy to work with any World Cup site who is wishing to develop a state-of-the-art ventilation system. It may be decades before research is effected on all these compounds. So with this in mind, it's imperative that we take the steps to protect people now and not wait to find out that we have really bad health effects from these down the road. After all, what's the cost of health and life? We're a family. We need to protect those who are participating in these events in the best way possible.